My name is Kia Labraki, and I'm with the Wisconsin chapter of the American Academy of Pediatrics, and I will be serving as the moderator for the developmental screening tip sheets. I have just a couple of house cleaning items before we get started. One is we will be taking some time at the end of today's webinar to address questions that you have. We are not able to do a live in-person talk. You won't be on the line. However, you do have on your screen a chat box where you can enter in your questions. And so we'll just collect those as we go and be able to address them at the end. Also, in that same box, if you happened to register yourself but wind up having other people who are listening in with you who may not have registered, we would love to get feedback from them as well. And so if they're willing to be sent the survey link, if you could have them enter their email address into that same box, those will all get recorded and we'll be adding them to our post-session survey list. Finally, we are happy to announce that this series of 6 webinars will actually give you CEU credit of 0.6 if you register and attend all 6 sessions. This credit does not apply to listening to the archive, but the live session only. And these sessions will be recorded and posted at the same website as the tip sheets. Just as a reminder, these are the 3 tip sheets we will be talking about today, and they are posted at the Collaborating Partners website, tip sheets 1, 2, and 3. So hopefully you've been able to print those out. If not, during the introduction here, perhaps you could take the time to do so. Today's session is going to be an overview of the developmental screening tip sheets. And these were designed to help communities who are looking to offer developmental screening for all children. The 3 sheets we're going to be talking about today are using the screening tip sheets, selecting a screening tool, and when to use a screening tool. In addition, as we move through, you will find out what the tip sheets are, why they were created, how you might use them, and where you might find them. The tip sheets are actually a series of 10 documents that are designed to assist you when you are implementing or refining a universal developmental screening system for all children in your community. Again, the 3 sheets we're going to be talking about are the first 3 of the 10, using the screening tip sheets, selecting a screening tool, and when to use a screening tool. Why were the tip sheets created? Well, we know from the American Academy of Pediatrics that there is an established screening and surveillance policy recommendation that was put out in 2006. And the recommendation is screening of all children with a validated tool at these regular periodicities. We have many people who are screening. There's no wrong door to identify kids with developmental delays. But we do want to ensure that communities are approaching screening as an integrated system with shared responsibility. The Healthy Children Committee of the Wisconsin Early Childhood Collaborating Partners designated a work group called the Futures of Developmental Screening. And what this work group wanted to do was to take a look at where and how screening was being done in various settings. How might you use these tip sheets? Well, they're designed to be standalone if you are at any different point in your implementation. So you might start with number 1 and proceed from 1 to 10, or you might identify a tip sheet that's best suited for where you're at in the process. You can also use these tip sheets as a means to expose people to the principles behind screening, the different steps in building the collaboration, and other uses. Again, on the Collaborating Partners website is where you will find the full set of tip sheets as well as the eventual archives of these webinars. On the Wisconsin chapter of the American Academy of Pediatrics website, the tip sheets are also posted.
All right, and I'm going to walk us through tip sheet number 1 using the screening tip sheets. So, introduce myself. I'm Jenny Maurer. I'm a member of this committee and happy to be with you here today. So as you'll notice if you've looked at the tip sheets, we wanted to point out that each of the tip sheets has a couple of common components that we really felt were important to highlight on all of the sheets. You'll notice that on the bottom left of all of the tip sheets, they read that why is developmental screening important? And we wanted to point out that routine universal screening of young children with a validated screening tool really helps us to promote a better understanding of each child, and that early identification of potential delays allows for timely access to appropriate supports and services promoting optimal development for every child. So we really wanted to set that stage as we pursue this work. We also wanted to point out the importance that parents and primary caregivers play in this process. Screening is only really as effective as it's connected to the context of children and their families and the communities that they live in. So we wanted to make sure that those were points that were brought to your attention on all of the different tip sheets. So you'll notice that they're repeated throughout. Each tip sheet also has a series of questions, what's next for your team and in your community. And on tip sheet 1, the conversation starter really focuses on your community asking questions about what are the assets and challenges that are unique to your community. So again, it's just a way to get the conversation started and help you to think about what might be next for your team. And finally, on all of the tip sheets, we have a For More information box. We all have the stack of reading materials on our desk, and we really tried to prioritize materials that we thought would be great places to start and help you to wade through the extensive amount of information that's available on the web. So it's a great place to start the conversation and take it back to your community. And so you might want to check out those resources. And now I'm going to turn it over to Dr. Ariana Kyle, who will walk us through the next tip sheet.
Thank you, Jenny. So my name is Ariana Kyle. I'm really pleased to be sharing this information with all of you today. I am the Medical Home Projects Coordinator. I'm working with Children's Hospital of Wisconsin, and I serve the Wisconsin Statewide Medical Home Initiative, and that's a grant that's funded by the Wisconsin Department of Health Services Children and Youth with Special Healthcare Needs program. Today I'm going to be covering the content on the 2 remaining tip sheets for today's webinar. Tip sheet 2, which is titled Selecting a Screening Tool, and then tip sheet 3, When to Use a Screening Tool. And to make the visual accompanying today's webinar just a little simpler, I'm just going to stay at the PowerPoint visual, and I'll ask that you reference the tip sheets themselves as we talk. However, I won't kind of toggle back and forth between the two. So let's start first with tip sheet number 2 on selecting a screening tool. And we'll talk first about criteria for tool selection, as well as a few developmental screening tools that were considered by the Wisconsin Early Childhood Collaborating Partners to meet the criteria we will be discussing. So if you're looking at tip sheet number 2, the very first page, you'll see that there are 5 different criteria items listed there that are recommended for consideration when you're selecting a screening tool for universal developmental screening for all children within your community. The first item you see listed is consideration of the tool's psychometric properties. So when we say that, we're thinking about the tool's sensitivity and specificity. So back to Statistics 101, the sensitivity is the true positive of a tool. So it's the number of children that are identified by a screening tool that truly deserve greater attention, whereas the specificity is the true negative of a tool. So it's the number of kids that are developing consistently with same-age peers that the tool says, yep, these results are reassuring. So in general, a sensitivity and specificity between 70 and 80% for a developmental screening tool is considered good. Above 80% is considered excellent, but sometimes can be difficult to achieve, especially in very young children. So that's the first consideration, what the psychometric properties of the tool are. The second consideration that you may want to weigh when selecting a tool is whether or not it's been normed on a wide variety of different cultural groups and across different populations. The third item to consider is whether or not the tool is a parent-completed instrument. And there are many good parent-completed instruments out there, as well as good professional-completed instruments. However, parent-completed instruments really have the advantage of really validating that parent-professional partnership and also to help promote parent understanding of child development, even for those children who have reassuring developmental screens. The fourth criteria you may consider is the ease and reliability with which that tool is used. Is it affordable? Is there training available? Those are things to consider. And then the last criteria that is listed on tip sheet 2 is whether or not the tool is used by a variety of community partners screening children. So when we have within one community different sectors using the same tool, there's really the potential there to have communication about that child and family really be facilitated. And that's something to consider in your decision-making process as well. So members of the Wisconsin Early Childhood Collaborating Partners Healthy Children's Committee reviewed a variety of good developmental screening tools that are out there. And when all of the 5 criteria we just discussed were applied, 2 tools really rose to the surface. The first is the Ages and Stages Questionnaire 3, also known as the ASQ3. So this is a tool that screens kids between the ages of 2 months all the way up to 5 years of age. It was written by Jane Squires and Diane Bricker. It is a proprietary tool, and it's available through Brooks Publishing. It costs about $225 to purchase an ASQ3 kit. However, once you own the kit, then you're able to make photocopies at will. It's a parent-completed instrument. It has sensitivity and specificity in that at least 70 to 80% range, so really meets that good psychometric properties criteria, and has been normed on a very broad population of children. It's also used by many community partners in different parts of our state. The second general developmental screening tool that also met the criteria outlined earlier in this tip sheet is the Parents Evaluation of Developmental Status, also known as the PEDS. So the author of the PEDS is Frances Glasgow. She's a professor of pediatrics at Vanderbilt University. It screens children ages birth to 8 years of age. And there is, as compared with the ASQ3, where there are a variety of age interval questionnaires, 21 different age interval questionnaires. For the PEDS, there's just one single questionnaire. And another distinction between the PEDS and the ASQ is that the PEDS sells individual forms. It's also a proprietary tool, but you have to buy one form for each child that you screen. So currently, the cost for 50 forms is about $36. So now we're going to move on to the second page of tip sheet 2. What's next for your team, and also for more information. So the question that's listed there under which developmental screening tool is right for your community, again, things to think about are the criteria that we talked about, as well as other partners in your community that are screening. And then under the for more information section of this tip sheet, you'll see the ASQ3 Users Guide listed. The fourth bullet, you'll see the PEDS, so a link to that second screening tool. The second bullet under this section of the tip sheet is a blueprint that was created from the Wisconsin Early Childhood Collaborating Partners to the Governor's Early Childhood Advisory Committee. It's really a comprehensive look at screening and assessment systems across the state. The third bullet point there is a really nice summary from Early Head Start looking at the role of standardized screenings in assessing infant and toddler development within their program. So I would encourage you to look at that, particularly the second page of that document, which outlines considerations for programs who are starting in on this process. And then the last resource listed on this tip sheet takes you to the Wisconsin Early Childhood Collaborating Partners Screening and Early Identification website, where you'll find a variety of resources, including a PowerPoint on creating early childhood councils, a link to DPI's Child Development Days, and a really nice summary of what's going on in the Racine School District and how they collaborate with partners like Birth to 3 and United Way and home visiting programs in their city to offer universal screening for all children. Now we're going to transition into tip sheet number 3, when to use a screening tool. And you'll see that as we're covering this screening tool, there'll be 2 slides accompanying it. The first slide really refers to the first page of the tip sheet, and likewise the second slide refers to the second page of the tip sheet. The very first page of tip sheet number 3 really walks you through the American Academy of Pediatrics recommendations that Kia covered at the very beginning of today's presentation. So those recommendations come from a policy statement that was published by the American Academy of Pediatrics in 2006 that are recommending that all children, regardless of concern, receive screening with a formal validated tool at 9 months, 18 months, and 24 or 30 months of age, as well as any time parents can express a concern or professionals have concerns about a child's development. So what I would encourage you as a group within your own community to consider would be to take the AAP recommendations and to talk them over, but to certainly consider them perhaps as a baseline for what might happen within your community around universal developmental screening. When there are multiple community partners that care for young children and their families interested in sharing that responsibility around developmental screening, there are many other age opportunities that might be available to screen children. And so the role of a coordinated approach within a community is really essential when you look at really promoting the early identification of children with delays, but also really wanting to minimize the children who receive multiple screens at the same age. And you'll find on the PowerPoint presentation that's listed on the Wisconsin Early Childhood Collaborating Partners Screening and Early Identification site that directs you on how to create an early childhood council. That might be especially relevant when you think about how to reach out to others in your community that might be interested in conducting universal screening. Continuing on the first page of tip sheet number 3, really emphasizing the importance of having many doors to really promote the early identification of kids with delays, and also the importance of taking into account the parameters of the screening tool that you select. So for instance, the ASQ3 has 21 different age interval questionnaires, each of which are valid for a plus or minus 1 month window of time. So you need to be cognizant of that when you're looking at how to set up your screening process. A tool like the PEDS, it's the same questionnaire that's valid from birth to up to age 8. So just being aware of the parameters of your tool. And now we're going to turn on to the second page of tip sheet number 3, what's next for your team and for more information. So you see the question there under what's next for your team, asks you to consider how often and at what intervals you might want to consider screening children in your community. And then 2 additional resources for more information. The first bullet point there will take you to a link to that 2006 AAP policy statement around developmental screening, again, universal screening for all children. And then the second link on tip sheet number 3 in that resource section takes you to a document that was created by Bright Futures as well as the American Academy of Pediatrics. It's titled Recommendations for Preventative Pediatric Healthcare, and it really lists a variety of health and wellness recommendations for children from infancy all the way through adolescence. And you'll see as you look down the chart that developmental screening is one of the listed recommendations. So at this point, I am going to pass it off to Lizzie Sexton, who's with Children's Service Society of Wisconsin in Madison. And she's going to talk to you a little bit about how their organization selected the screening tool that they are using to screen children's development, as well as the frequency that they have chosen. So Lizzie.
Hi everyone, this is Lizzie Sexton from Children's Service Society of Wisconsin in Madison, and they selected me to come and talk to you about living in the trenches and what using the ASQ really means to agencies and communities. We've been using the ASQ since 2008. We're almost to our 5th year. And really the selection of the tool came about through a year-long process by our United Way, where they examined many tools. The United Way was concerned about the number of children who were unready to attend kindergarten. And knowing about the American Academy of Pediatrics recommendations, developmental screening was one of the things they included in their blueprints for change. They chose the ASQ largely for its relatively low price. Ariana mentioned that, but really for $250 plus $50 shipping, you screen as many children as you'd like and for as many copies as you can make for that price. It really is a very good bang for your buck, and the United Way was looking to screen a large number of children, hopefully all the children in Dane County. When you're looking at community partners, $300 is a drop in the bucket. A Lions Club, United Way, many community organizations feel good about spending that amount of money and perhaps getting that amount of information and good work out of it. Minimum time investment. We're looking at trying to look at lots of kiddos and talking to lots of parents, sometimes with limited resources and time. And the ASQ, which is the tool we chose, as I said, really does have quite a minimum time investment. It doesn't require the person in the white coat with the clipboard. It's parents, and parents spending an average of about 15 minutes completing the tool. And believe it or not, staff can evaluate results in as little as 5 minutes after the ASQ has been completed. Easy to use, written at a 4th to 6th grade reading level. Parents find it friendly, and questions usually are easily understood. Ariana talked about the validity. It's amazing, after hundreds of years, science has proven that parents know about their children and actually know as much or more as those folks in the white coats with the clipboards. Really empowering for parents also to be told, yeah, we trust your answers. Another thing that really came into play is we knew that the school districts in the area were using the ASQ, as was Birth to 3. And so we were all talking the same language. When we make a referral to Birth to 3 or to our school district, we know they know what we're talking about. We don't have to ship them an entire questionnaire. We just ship the results, and we know they know what it is. It's made things a lot easier. Our parents who are referred walk through the door with that ASQ in their hand, and they've already jumped through the first hoop, because Birth to 3 and the school district would both ask them to complete that as a first step. The parent completion factor is probably the most important. Certainly in terms of empowering families as the experts on their children. Someone in a white coat with a clipboard gave this to me and wanted to know what I knew about my child. I am an expert on my child. Also just creating that relationship between a parent and a program. We want to talk about your child. We'll tell you what we know, and we'd like to know what you know. Also, just the parent education piece. This is based on milestones, and parents are going, oh, well, my baby's supposed to be holding his head up without support. He or she is not yet. Or, my goodness, my baby did that months ago. must be special. One of my stories is getting an ASQ in the mail for a 10-month-old who literally said not yet to every question about gross motor development. And I gave the parent a call, and she said, oh my, as I went through that ASQ, I knew that was going to be a problem area. She said, you know, this baby's feet have never hit the ground. This baby is a carried baby. And she said, when I read about cruising and taking first steps and pulling up, I realized that maybe this baby should have some floor time. And of course, this was not a referral to birth to 3. This was parent education about what was typical for a child, her child's age. We now have about 13 community partners, and these include school districts and social service agencies. We have an alcohol rehab center. We have homeless shelters. Our libraries are now offering this free for parents to take home and return to my agency for assessment. And I'm happy to say we now have actually screened over 3,000 children in our community, and we're able then to keep statistics about how our county is looking and also what services we need more of. The other thing, just back to the parent completion factor, the other thing is this really offers parents a lot of good ideas about activities with their children. And one of our parents came in and they said, you know what, we have a baby and we don't use books with our baby. Books aren't for babies. We wait till school. Children can have books once they go to school. They said, but the ASQ said when you show your baby a book, does she point to the pictures? And they said, she did. And they said, we're going to start reading to our baby. And I said, maybe I didn't collect as many ASQs as I could this year, but I have a family reading with their baby, and that was really wonderful. Also, parents who didn't know how much they knew, who really gain a new appreciation for their child, whether it be a concern or whether it be a joy. And at that, I think we'll change the slide. Our particular agency uses the ASQ in 2 of our community programs. One is a 1-day-a-week 2-hour preschool program, and the other is in a home visitation program. And we all sat down and came up with a protocol. We said, who is going to do this? When are they going to do this? How are they going to do this? This was probably the most important thing we learned. And as you can see, I put it last, but I should have put it first, because the protocol really has directed our actions around the ASQ. And in that protocol, we decided that children should be screened every 6 months. We decided this based on everything from realizing that this was a snapshot and wanting to do this continually because of the AAP recommendations, but also because of feasibility. What could we do comfortably and reliably and responsibly? And we decided on the 6-month interval. We also offer an ASQ whenever a child enrolls in our program to kind of get a baseline. Also to start that wonderful parent-agency relationship. Day 1, we're asking parents what they know about their children. We also offer ASQs whenever a parent requests one, as well as whenever a parent or staff member has a developmental concern about a child. Anyone can ask at any time, and we have an ASQ ready for them to do. We also, as recommended by the ASQ3, do rescreens regularly. And these are those kiddos, you know, who don't have a ton of red flags up, who aren't below the cutoff, but who are kind of in a middle area where more experience or practice might be recommended or is recommended. And so what we say is, let's start practicing and providing experiences, and then we'll rescreen. Often we'll rescreen with the next regular ASQ at the earlier ages, or with the older ages because the ASQs come less regularly, in fact every 6 months, at 3, 4, and 5. We'll say, let's do this between now and when the next ASQ would be done, and just make sure that this child's development is going in the right way, in a positive way. So I'm really looking forward to seeing your questions and hearing your comments. I do the ASQ all of my working hours, and my husband would say all of my waking and sleeping hours as well. So you have my contact information, and I'd be happy to help you with any ASQ questions, as I'm sure all of our panelists would. I really welcome you to the journey of developmental screening, and I'd like to turn this over to Kia with some participant comments and questions, and here she is.
Lizzie, thank you for that wonderful picture of what it's like to actually implement some of the ideas that we're talking about. I think that experience is so critical and valuable as our listeners are thinking about this issue, regardless of where they're at in the process. So we had a question regarding the PowerPoint, whether the PowerPoint is going to be online. And it will be online along with, at the same site that we told you that the tip sheets are posted and that the audio of today's session will be posted. And so everything will be available to you in one place. The next question is with regard to the age of the ASQ, and I'm going to pass this over to Ariana.
So the question says, at what age is the ASQ starting at? You said infancy, but what age? Our center begins taking children at age 6 weeks. So that's an excellent question. So when you look at the entire toolkit of an ASQ3, you'll notice there are 21 different age interval questionnaires. The youngest age interval questionnaire is 2 months. And so that can be used, again, if each questionnaire is valid for a plus or minus 1 month window of time, it could, in theory, be used to screen kids as young as 1 month of age. However, my caution to you is this: the sensitivity and specificity of the overall ASQ questionnaires is between 70 and mid 80%. Overall, the questionnaires do a really nice job. But in that very youngest age group, the questionnaires aren't as sensitive nor as specific as in the older age intervals. So once you get to the 6 month age interval, and certainly by the time you get to that 9 month age interval questionnaire, the first one that AAP recommends screening kids, then the ASQ questionnaires really fall into that good psychometric property zone, whereas the 2 month questionnaire sensitivity specificity not quite as solid as the others. You'll see all of the data behind that, the specifics within the ASQ3 User's Guide, so I would encourage you to look at that user's guide yourself if you decide to purchase that tool and really weigh the sensitivity and specificity of those really young questionnaires when you consider what age to start screening. Lizzie also has a comment.
And I totally agree with Ariana. I was going to add that with all the added benefits of the ASQ and a parent-completed questionnaire that are totally separate from knowing if a child has a potential delay or not, sometimes we'd like to offer those ASQs with the caveat that the results are not going to be as accurate, for example, as at the older ages. But to get those, especially new parents with little guys, taking a closer look at their child's development and getting ideas about activities and starting to put on those binoculars or those glasses to start noticing things. And so we found those early questionnaires very helpful in that way.
So this is Ariana again. We have a few additional comments and questions, and I really appreciate your willingness to share your thoughts as well as your questions. Just another follow-up comment about the ASQ we received, that this is someone from a daycare setting, and they say they use the ASQ there. And they also use it in collaboration with family physicians and pediatricians in their community, as well as Birth to 3 and the schools. the comment is, it's a nice way to all be on the same page. And boy, we've really seen that in other communities throughout the state too. When people are using the same tool, it really can help facilitate communication between different sectors and really help to really make the process more seamless for children and families. We also have a couple questions regarding the PEDS. Again, that is the General Developmental Screening Tool, the Parents' Evaluation of Developmental Status. One was, what's the sensitivity and specificity of the PEDS? Overall sensitivity and specificity in that good range that we were talking about before, between 70 and 80%. It obviously really depends on which age group you're screening. Again, it's just that one questionnaire for all ages. I would encourage you to go on the PEDS test website, which is one of the resources that's listed on that tip sheet number 2, and you can see the specifics behind that. Another question on the PEDS is the cost. Right now, their website says it costs $36 for 50, that's 50 screening forms, as well as the interpretation forms. So for $36, you get 50 of each, but you're required to buy one form, both the response form and the interpretation form, for each child that you screen.
Hi, Lizzie again, and I'm seeing a question. Are all 3,000 children located in Dane County? And in fact, they are. This is not just Children's Service Society who has completed these ASQs, but partner agencies. And for example, our Access Community Health Center is now doing literally hundreds of ASQs every month. But we did, our goal would be to screen children at least 3 times in their first 5 years, and that would be all children in Dane County. And to do that, we would need literally 28,000 each year. Another question is, how do you use the ASQ with non-reading parents and non-English speaking parents? This is a very good question. The ASQ is now in Spanish as well as English. There also is a Hmong version being developed, which will be an auditory version. With our non-English speaking parents, we need to set aside extra time, and we do it like an interview, reading each question to parents. And so I say the ASQ might take 15 minutes. With non-reading parents, it will require more time. We once had a Spanish-speaking dad with 4 children who didn't read, and that was a worthwhile endeavor, but a long one. I guess I wanted to say just one more time in terms of that number of 3,000 and our goal, and once again, universal screening, really all the evidence says we're not finding all the kiddos who need help just with our best instincts. And so therefore, a lot of the children we feel are doing just fine. Through the ASQ, we find that they could use some extra help. And so that is one of the reasons why universal screening is so important, and not just to use it for that child we might already have a worry about. Where are you guys
So
going?
a couple of questions and comments. This is Ariana Kyle again. One question about screening a baby who's, or a toddler who's 21 months of age and who has RSV or respiratory virus, and another child who is 30 months of age with leukemia. So neither of those conditions would require you to select a different age interval questionnaire on the ASQ3 for such children. The authors of the ASQ3 really just say you use each age interval questionnaire for a plus or minus 1 month window of time, and the other criteria that you consider when you're selecting the appropriate age interval questionnaire is whether that child was born prematurely. So the authors of the ASQ define prematurity as birth before 37 weeks gestation, okay? And they recommend doing that correction for up to 2 years of age. So if you have a child in your care who's less than 2, who is born before 37 weeks gestation, they recommend calculating that child's corrected age before selecting the appropriate age interval questionnaire. In terms of if the child has a medical condition, that wouldn't necessarily require you to select a different age interval questionnaire. What I would emphasize, however, is if you know already that a child has a developmental disability, there's no need to screen that child. Tools like the ASQ and the PEDS, really their role is to identify those children who are in need of more developmental assessment, a more in-depth look at their development, and then to hook them up with the appropriate supports and services. If you have a child in your care who's already in the Birth to 3 program or in early childhood special education, that is not a child that needs screening. Lizzie has additional comments.
I always have additional comments. And we do exactly the same thing, although we have had children who, for example, problem solving and communication are being looked at by Birth to 3, and there are real concerns that this kiddo is a dynamo when it comes to running and jumping and sliding. And so sometimes, and the authors actually talk about this as well, we might choose a domain that a parent could do both to learn more about their child as well as to appreciate some of the things that child is doing well. But in terms of using it as an indicator of whether a child needed more help or experience, we wouldn't do that whole thing. That's already been determined.
So another question that's coming in again, and I just want to thank you again for your willingness to enter your questions here. One is, do you have a hands-on training for the ASQ? And the answer is yes. In the state of Wisconsin, we have several options to receive training on the ASQ. The University of Wisconsin Extension offers an ASQ training 5 times a year, so you can, all across the state. Pence Revington is the person who's in charge of that program, so you can go on the UW Extension website and find out more information on that. However, I would, it's always ideal, I think, to get training and to really be well-versed in the tool. The ASQ, however, is designed to be self-taught. And so if your organization does not have the resources or the time to attend, that's always an option for you as well. And if that's the case, I would strongly encourage you to really review the user's guide closely and follow the guidance in there.
And in addition, try to hook up with someone who's been doing it for a while. This is Lizzie again. Simply a lot of good support coming from folks who have been through the process and know what it involves. Often even the logistics can be the tricky parts of it.
So let's see, we have another question on Birth to 3 and their use of the ASQ. And again, in Wisconsin, we have 72 different counties, and so 72 different Birth to 3 programs. And so although the mission and philosophy and the charge to each of those programs is the same, sometimes the way in which they carry out the specifics is a little different county to county. So this one states that their Birth to 3 program, the ASQ, is used to screen children who don't have a diagnosed condition. And so, and we see many Birth to 3 programs across the state doing that use of a developmental screening tool like the ASQ is really an important first step in that program deciding whether or not this is a child who really needs additional attention. Another question on, does the ASQ look at behavior? And so the answer is the ASQ screens children's development in 5 different domains. Communication, which is both receptive and expressive communication, gross motor, fine motor, personal social, which gets at more of that behavior area, and then problem solving or cognitive. So the answer is yes. There's also a specific social and emotional version of the ASQ that looks at those behaviors in greater depth. And I'm going to pass it off to Lizzie for her comments as well.
And I reiterate everything that Ariana just said. The ASQ by itself, the personal social is the most closely related to behavioral issues. The personal social really is looking at many things like activities of daily living and dressing oneself, even taking turns, those kind of things. So really, in terms of the social emotional aspects, you might look at the ASQ SE. Another really important thing about the ASQ that we haven't talked about is at the very end of the ASQ there are open-ended questions. And one of them is always, is there anything else that worries you about your child? And believe it or not, this has been extremely informative for us. Often things like children on the autism spectrum are caught here, as well as parents who really are asking for resources. We had one mom who said, my baby screams all night. I have to put a pillow over my ears. I can't stand it anymore. And we were on the phone immediately with that mother. And behavioral issues often show up here too. My child is very shy. My child doesn't enter play. And this is the perfect place to find resources for these families. I always say, if a family has taken the time to put a pen in their hand and written down a concern, it really is worth it for us to take a close look at that.
We're going to take just one more question. We're mindful of time, and so we are going to take just one more question.
One of the questions was about the timing of having parents complete the questionnaire. And there are a variety of ways that this can be done, and it depends primarily on your organization and how that might look. For the medical clinics that we support, oftentimes they will mail out the questionnaire a week or two in advance of that child exam and ask the parents to come with the form completed. Others, they hand it out right there when the parents are there for the visit itself, and they give them an extra 10 or 15 minutes in the waiting room. Other home visiting programs will fill it out with the family right there in the child's home environment, and that's the best situation. And so I think that, the ASQ was validated in a setting where it was done where the child was in a familiar setting with familiar people, and that's always the best. So I'm going to pass it off to Lizzie for her last insights.
And on that, I just have to say the ASQ is like milk. It has an expiration date. And in other words, one day a child will be valid, or an ASQ at 10 months will be valid for a child, and then the day later, it might be the 12 month. And so when we send these home, which we do sometimes from our preschool program, we will let a parent know this needs to be completed by a certain date, because we don't want to waste that parent's time doing an ASQ that isn't valid for that child. Actually, Brooks Publishing has a wonderful little website up now where you can actually type in the birth date of the child and the date the ASQ is being done, and it will give you the appropriate ASQ.
I've had my arm twisted, and I'm going to just answer one more. This was asking about the distinction between the PEDS and the ASQ, in addition to the points that we covered earlier. And if you look at the PEDS, if you go online and take a peek at the form, you'll see that the questions there are all open-ended questions. So they really prompt the parent to identify broad concerns. Do you have concerns about the way your child is talking, about the way your child is walking or moving? Whereas the ASQ asks about specific skills and whether or not the child is completing or doing those developmental skills. So there have been some research studies published that suggest that the tools are better at identifying different types of delays, and that also that the PEDS might be more sensitive in families that have experience. So they're anticipating that their child should be doing these things. So there are some differences between the two tools. However, overall, both of them have reasonable levels of sensitivity and specificity. So I'm going to pass it back to Kia, and she's going to wrap up today's webinar.
Thank you, Ariana. I just want to thank all of our presenters for doing such a wonderful job of giving us this introductory session. As you'll see on the screen, we do have the remaining webinars all scheduled, and it will be during this same time frame from 12:30 to 1:30. The next one is on November 15th, and will cover engaging stakeholders and promoting collaboration. January 17th, we will have the Engaging Parents tip sheet covered. In February, sharing screening results with parents. March, sharing screening results with partners and using screening results. And finally, in April, culturally and linguistically responsive screening practices. Again, to register for all of these webinars, you can go to this website here. And again, we are going to be posting all relevant information to each of the webinars at the same site as the tip sheets. So we want to thank you again for your patience at the beginning of the webinar as we got our audio situated, and expect to receive a follow-up email with a link to a survey evaluating today's session so that we can continue to improve them. Thank you so much.